Okay, we'll be on standby until Jonathan can join us. All right, good morning, Jonathan. We are ready for the Tribal Health Committee meeting.
Thank you. And good morning. Today we wanted to update you on a couple of different issues. The first issue would be communication that we've had between the regional tribal group that are planning a regional tribal inpatient facility. We've often discussed, I think, in the past, the different levels of the continuum of care regarding that. And so the first meeting was held in Billings, and everyone, every tribe attended. They had, I think, 100 people, and it was very successful. But I think initially, can I do a quick screen share so I can just refer back to one of the
Yes, that should be available to you.
okay, thank you. I want to refer back to the one of the screens that I prior showed. But essentially, they all agree that there has to be an overall approach tribally to an inpatient center. They all agree that there's a need for it. Although I will say at this particular point, I think that they're looking at Billings East. That seems to be their focus, although they do see a need for the Missoula area, this side of the state, in terms of the clinical interventions and the models therein. But that's why I think we have determined internally at this point, and I'll give you more follow-up on that meeting in a moment, but we're continuing and moving in a direction where there may not be a lot of help for the model that we'll be creating for the tribes. We see lots of opportunity there. They're going to meet again in September and develop a mission statement, and then they're coming. They'll have some representatives from the groups, from the regional tribal group, coming to present to us, and I'm not sure if that's to the council directly or to the Department of Health. We'll discuss that with Rick on how to proceed there, but they want to discuss what their goals will be for the regional tribal inpatient centers. So that will be in September. They're coming in September. That's the goal that they have at this point from their first meeting, which was 2 weeks ago. So the second meeting is in August, and then by September they hope to be doing their rounds to the councils of the tribes. And they will update you on where they're going. So in saying that, after having that meeting, once again, I feel strongly that we have to proceed as though this is something that we have to do internally in terms of the tribes, approaching the inpatient-outpatient continuums that we've discussed in the past. Can you guys see that screen? So,
Yes.
in explaining what happened with that meeting, I think the second part will be, for an update, will be the roundtable. So we waited until we got some more information regarding what the overall thought process was for the regional group that's being led by Health Management Associates, a consulting group, through the Montana Healthcare Foundation. So now we're back to focusing on the internal needs of the tribes, how to assess that, gather the data, and determine where in the continuum of care on that screen for the ASAM levels the greatest need is and how to approach that. So we know we'll get a lot of help from best practices. I know that in past meetings we talked about like the success locally as well as some of the tribes like the Bakken tribes. I know that the Health Management Associate Group, that's the consulting company that is being utilized with the regional group, they like to look at the best practices from a group in Phoenix that provide tribal services, and they've got a lot of success out of the approach they gave. which utilizes a building that encompasses more than one of these levels of care, from intensive outpatient services to inpatient, clinically managed, all the way up to medically monitored. So I think with this roundtable group, with all the folks that we'll be bringing into it, which will probably be close to 20 some folks at some point, maybe more, we'll make the determination from those resources and from those folks on which of these levels of care that we need to focus on first. And we also know that we have to do have some community involvement. We need to get involved with the community and see what they see as their needs. We need to get feedback from them to make those decisions. And that's hopefully our first roundtable discussion will happen by the end of the month, but July is kind of crazy right now. Everyone wants to meet, but I think July has probably not been real successful in terms of getting everyone together for a meeting, so it may be pushed to August, but that's when we'll begin the real conversation on how to proceed there. Are there any questions in terms of where we are after our meetings?
So I think this could be a good topic for discussion at our district meetings coming up in August. So if council want to keep that in mind, that'd be a good way to get community input. I'm really glad to see this already underway. We just passed the resolution on Tuesday, which I'm sure Rick has shared with you. If not, you'll be getting it shortly, but to move forward with eradicating addiction. So thank you, Jonathan.
Absolutely. Also, that was really encouraging to see is it the HEART program from the state of Montana? That's a waiver program through Medicaid. I don't know if anyone's had a chance to look at that, but it focuses heavily on housing support services and tenancy support services for addictions, and that could be a tremendous amount of help for resources for those Medicaid recipients to help people during their fight against addictions. So that was really encouraging to see today.
Yeah, I think I forwarded that to you, Desiree, and Miller, and Suzette Billadu for input on that, because it did involve housing, or what did they call it?
Transitional or support, I think, housing. So there'll be some Medicaid dollars allotted from the state to help us provide that, which is a huge part of recovery, especially in outpatient venues as well. So there's tons of resources that could and will be available. I don't think the concerns have ever been necessarily having the ability to build or set up an effective continuum of care. The biggest fear we have in the Department of Health, or challenge I should say, will be staffing it. Staffing's, I think, our biggest concern or challenge. So that's where we're going with that. Is there any other questions related to this before we move on?
Are there any questions from council?
Okay, the next part, thank you. The next part that we wanted to discuss today are projects that we're working on, and Chelsea's helping us manage and develop. Our two-part, one is the cooling centers, those cooling stations, where we're trying to utilize our facilities to do some type of venue for people to come in if they don't have air conditioning or don't have the ability to cool their homes. And then we've combined that and trying to be proactive with Chelsea's leadership regarding smoke and inhalation from the fires, and how to also help folks with that. So Chelsea, would you like to join in and explain what we're doing there?
Absolutely. Good morning, everyone. So what we know right now is we have the Elmo, St. Ignatius, and Arley fitness centers that we're going to use as the cooling centers, as Jonathan described. These will be open from at least the hours of 12 p.m. to 8 p.m. Daily at this point. And we are going to do that through the end of August. If temperatures continue into September, then of course we will look at extending those hours at that time. So right now, using the fitness center employees who are already staffing the fitness centers, we can staff these until 8 p.m. each day, Sunday through Saturday. In addition, we are monitoring the smoke levels. And so I've been trying to be a little proactive and getting a message out on Facebook to let people know what the air quality level is for the day across the reservation. This morning when I checked, it was at unhealthy levels in Arlee, which really means that people who are sensitive to smoke, people who have certain medical conditions, should stay indoors. And so we want the community to know that if the smoke continues at these levels, they can also go to these cooling centers to escape the smoke. We realize that, the recommendation is to have your windows closed. And for some people, with that coupled with the heat, it's not safe for them to be in their home. And so they can access these cooling centers to escape smoke as well. Additionally, we will have transportation available for those families that live far out from these cooling centers who do not have the means to get there. We're asking that they call 849-5798 and they'll be assisted with arranging transportation. That phone number is actually the COVID hotline. So we've had it out there a lot over the past year. It's also the Elmo clinic phone number. And so they will reach someone and will arrange for them to get transportation to the cooling center / smoke escape center. So that's what we have going right now, again, at least through August.
So Chelsea, you say rides are available, so are you guys doing outreach to check on elders, or you're just making the announcement here and on social media?
We are doing both. And so we are reaching out to elders and letting them know of the availability. We're also checking on our vulnerable patients. The community health teams are checking on the people that they know are most vulnerable to ensure that they're doing okay and let them know about the resources that we have. Of course, assisting to arrange for rides if needed.
Okay, and I think we talked last week, you and I and Constance, about working together with them and starting with the oldest of the old to check on them. They may not necessarily be one of our patients. They might just have their own primary care. So I don't know how you guys define our patients, but I think all tribal members.
Yeah, so within community health, for sure, we see all patients that are eligible for tribal health. So regardless of whether they have a primary care provider at tribal health or not, if they get seen by a provider at St. Luke, we are aware of those patients. We receive referrals on them from outside providers. And so, we're checking on those who are eligible for tribal health that we know are more vulnerable.
Excellent, thank you. Any questions for Chelsea? Well, thank you for this service.
Thank you, everyone.
So, Madam Chair, that's our update for today. Of course, we'll have a more comprehensive approach once we've had an opportunity to read the resolution and address it for the tribes.
Okay, Mike has a question, comment?
Thank you, Madam Chair. Jonathan, I'm just wondering about the COVID situation as this new variety is taking hold across the nation.
So, yeah, the variants of concerns are things that we're discussing, obviously, internally and concerned about. And Chelsea, you know, if you have any information, you can jump in at any point. But the variants of concerns that we're primarily looking at are, of course, the alpha variant lineage as well as the delta. The delta is the one that seems to be at this point more aggressive. I know that we've only, as of 7/7, there were 23 cases documented of that, but 23.3% of those people were hospitalized, which is pretty scary. To give you an example, the alpha variant lineage had 357 cases here in Montana, where only 8% of those were hospitalized. So, you know, we're of course standing by and aggressively following any advice we get from the CDC, IHS, etc. on that. I think the Delta variant is going to be a game changer if that becomes the variant of concern, primarily here over the Alpha variant. Chelsea, do you have anything you want to add to that?
I will just note that, we did have a little bit of, a spike in cases. We were down to 1 active case in the county. We're now sitting at 8 active cases, and many of those have been fully vaccinated. Again, the state of Montana isn't testing every sample at this point for a variant of concern. And so it's really hard to get an understanding at this point if we do have any variants in these fully vaccinated individuals.
Bing?
Thank you, Madam Chair. This is not what Mike was just talking about, but I had an issue. Was up there at during the memorial preparing for the dinner up there, and I noticed in the kitchen up there that there were signs posted where cooking and meal prepping is no longer allowed in the kitchen up there in the center. And I was wondering, I said, since the center's open now, I said, what's going on with the kitchen? Why can't we, for our wakes and whatnot up there, that I know that kitchen needs to be used, and I was wondering why these signs are still posted up there.
I'll have to investigate that for you, Councilman, and I'll get back to you on that. I don't know exactly what policy has changed there. I'll find out for you today.
Thank you.
Thanks, Bing. Yeah, this was brought to my attention a few weeks ago, and John said it was just a late signage thing. Yeah, and so he was going to address it with John Nice to make sure those things were taken down. But yeah. Charmel?
Thank you, Madam Chair. I don't know if there is any particular recommendation that the tribal health personnel might make as far as communicating to the tribal public or just the reservation public about the variants of concern and what's, a little extra information, I guess, that because, until you just said it, I wasn't aware of the, the percentage of hospitalization on the Delta variant, for example, and the fact that you're saying that the 7 active cases are individuals who were fully vaccinated. That's concerning to me. And I'm sure a few days ago when someone mentioned to me the rise in cases, I was looking for information about, kind of where hotspots are. And what I found a few days ago was telling me that the #1 hotspot in the United States for, I believe, the variant of concern is Clark County, Nevada, which is Las Vegas. Um, that is something I think we should keep on our dashboard, you know, like what's happening. And anyway, I don't want us to get caught in the middle of a surge of hospitalizations and issues. Thank you.
Thank you,
Right.
Sharna.
That
You have
is a
something, Martin?
sorry.
No. Go ahead, Jonathan.
I know. Yeah, I'm concerned about that as well, Councilwoman. Flathead, has 87 variants of concern, and I think that's probably pretty high, as well as Yellowstone for, obvious reasons, since we've opened up and the tourist season is here. So I'm sure you're thinking the same thing I am in terms of Las Vegas, seeing that as well. So I think, and Chelsea, if you have anything to add, but I think we're all just watching right now, and we're encouraging people internally. We're having to remind people to stay vigilant, to wear masks, to follow the COVID protocols. That these variants are coming back. We're seeing increases again weekly throughout the world. It's a very aggressive variant. It's different, and we're not, out of the woods yet. We know that the vaccines are, well, they're keeping people, I guess, from dying more. The vaccines are working against some of these variants. Unfortunately, those that are unvaccinated are not having the results that the vaccinated people are in terms of overcoming the disease. And I think that's where everyone's focused, is to keep pushing the vaccines, to constantly remind people that the vaccines are keeping people healthier. They are keeping them, from deteriorating. And the unvaccinated are just really, seeing some horrible results from the variants, especially Delta. Chelsea, do you have anything you want to add in terms of how we're approaching this?
I do not have anything to add.
Madam Chair.
Go ahead, Anita.
I'm sorry, I had a question. Have we had any reported problem with people using the Johnson & Johnson? That's one of my questions.
So one of the things that's happened, and we're not sure if it's related to the blood clotting issues and the other issues related to the J&J vaccine, but we have seen here within the state of Montana, we're not even receiving the vaccine anymore. There's, from what I understand, and I can't verify this, it's more of a production issue, but we're not even seeing new allocation of that particular vaccine. Is that correct, Chelsea?
That is correct. Tribal Health still does have some on hand, but what we have is all we're going to have at this point until more comes into the state.
Excuse me, as a follow-up, I was also wondering about the kids, because now they're getting the increase in the young kids getting the COVID.
So, yes, and we're, obviously focusing on that. That's one of the things we're looking at. Some of the vaccines are appropriate for that age. They're still in testing for a lot of those age groups. I think Pfizer, was it Pfizer that was the first one approved from 12 and up, Chelsea? I can't recall.
Yes, and so far that's the only one.
And the others are testing, and they're looking to go even much lower in age. Is that correct, Chelsea?
Yes, we anticipate in the fall, so right around the start of school is when we'll be able to vaccinate, I believe, around 9 years of age and older.
And then also the manufacturers, I'm sure you're all reading this as well, but they're looking at boosters. They're looking at a pill form that could provide that booster. things of those things are in testing. Things of that nature are in testing. So we're hoping that we'll have more tools. We also feel like once it gets to a possible pill form, a lot of folks that typically shy away from vaccinations, from the needles, might be more amenable to the pills, and that will help increase our overall percentage of folks getting vaccinated.
So I was wondering what vaccination are we administering through the mobile clinic?
So currently we are using the Pfizer and the Johnson & Johnson. I do have, we don't have the most up-to-date information on vaccine uptake for the 12 to 17-year-olds, but it is still quite low. I'm trying to find the most recent data, and I'll scroll through and get that for you guys real quick.
So also, Chelsea, if you could update them as well. I know you're trying to multitask, but I know that you have a vaccination campaign within community health, and you're looking at different ways of approaching the community with your vaccinations, correct?
Yes, that is correct. So really quick, here is the most recent vaccine uptake for Lake County. So as you can see, among the 12 to 17-year-olds, we're at 20% vaccinated, and then 18 to 29-year-olds, 34%. So we are still quite low. So what we are doing right now, it should have just been sent out by Constant Contact, and it'll be on Facebook, but we are going around throughout the month of July and August to various reservation communities and events to offer the COVID vaccine. In addition, we realize that children need to have their regular immunizations as well. And so we are prepared to offer all childhood immunizations, but really, hoping that we can reach some people who maybe wouldn't come to a clinic, that, trying to make the COVID vaccine accessible to the community.
And if there's no more questions regarding that, Madam Chair, I'd like to give you a quick update on the Ronan Clinic project.
Okay, I don't see any questions. Go ahead.
So it looks like we're 99% there, and I'm sure you're getting updates, from the other side as well in terms of the Ronan Clinic project being on schedule. It looks like right now we're going to be able to get that foundation and those building walls up by mid-October, I think, or late October. So I think we're panicking on that a little bit, but it looks like it's going to come to fruition. Thank God for that. But the other thing that I'd like to share with the council today is I wanted to reiterate that our goal with the Ronan Clinic, besides being able to offer a lot more services through pharmacy, is to have more of a walk-in approach from that clinic and be able to handle more immediate needs. And it's, once again, I'd like to report that we're really excited that Dr. Pierre is going to help us run that clinic, set that clinic up, and provide services there. It's kind of a different approach in terms of maybe the way we functioned in the past. We want to be able to provide services more immediately. We used to do more walk-ins pre-COVID, obviously, but we really want one clinic where folks who have a sick child or have an emergent need can get quickly into tribal health and get those services on that day. So that's the goal of Dr. Pierre and Dr. Quorum and I, is to make sure that we have more flexible hours. We're hoping to provide later hours after work, more hours before work and possibly even Saturday services at some point. We want to be a provider of choice within the community. Our goal is to constantly improve our best practices and provide services in a way that the community sees us as a viable option in terms of care.
Go ahead, Carol.
Thank you, Jonathan. It's really nice and refreshing to hear that. When you go to that clinic in Ronan now, the walk-in clinic, you see a lot of your tribal people there. And I think with access to that, where people can just walk in and get some services, I think critically important to not only our stability, but to the health of our membership. So I'm really glad to hear that there is going to be a clinic like that. And so really thank both you, Dr. Quorum, and Dr. Fox for, thinking about this and making it something that's coming to fruition. So thanks.
That's all the updates I have today, Madam Chair. If there's any other questions.
Any other burning questions from council?
Thank you.
Okay, doesn't look like it. Well, thank you for the updates.
Thank you so much.
Okay. Jen tried to get the International Joint Commissioner on early, but he's traveling here in person. So he won't be here till 12:45. So with that, I guess we can recess for lunch, but Jen has a question for everybody.
They need a head count for next week's lunch on the 22nd for the SP.
It's the State Tribal Relations Committee.
It's going to be here. So I know we have Shelley Ellie being out and then the mission seat is vacant. So there won't be a quorum, but Rick said that it would still be able to have the lunch though. So.
The State Tribal Relations Committee. She needs a head count for lunch.
And that's going to be here?
Yes.
Next Thursday?
Yeah.
And they also wanted to know how long did you guys want the chief judge to advertise for? Okay.
Anita, we just need your confirmation for Thursday.
Oh, I put my hand up twice. I guess you keep missing it. Sorry, Shelley.
So 6. Yeah. Okay, I think that's it for the morning session, and then we'll just, did he say he could be here at 12:45 or 1? Okay, all right, we will recess until